This is the spinal immobilization for the supine patient. In this station, you'll want to make sure that there's a long board, a variety of size collars, and other materials needed to properly immobilize, including material to pad voids and straps. This skill is designed to evaluate your ability to provide spinal immobilization to a supine patient using a long spine immobilization device. You arrive on the scene with an EMT assistant. The assistant EMT has completed the scene survey as well as the primary assessment, and no critical condition requiring any interventions was found. For the purposes of this evaluation, the simulated patient's vital signs remain stable. You are required to treat the specific isolated problem of a suspected unstable spine using a long spine immobilization device. When moving the simulated patient to the device, you should use the help of the assistant EMT and me. The assistant EMT should control the head and cervical spine of the simulated patient, while you and I move the simulated patient to the immobilization device. You are responsible for the direction and subsequent actions of the EMT assistant and me. You may use any equipment available in this room. You have 10 minutes to complete this procedure. Do you have any questions?
No. BSI Scene Safety. I'm going to direct my EMT assistant to place the patient's head in a neutral inline stabilization. I'm also going to direct her to maintain that manual stabilization of the patient's head. And now I'm going to assess distal motor sensory in all 4 of my patient's extremities. Distal pulse is present. Can you feel me touching you, sir?
Yes.
Can you wiggle your fingers for me? Good. Capillary refill is present. Distal pulse is present. Can you feel me touching you, sir?
Yes.
Can you wiggle your fingers for me? Thank you. Capillary refill is brisk, not delayed. Distal pulse is present. Sir, can you feel me touching you?
Yes.
Can you move your foot for me? Good. Distal pulse is present. Sir, can you feel me touching you?
Yes.
Can you wiggle your feet for me? Thank you. Now I'm going to apply the appropriate sized extrication collar. And I will ask my EMT assistant to slightly lift my patient's head so I can apply the collar. Thank you. Okay. I'm going to ask my other EMT assistant to come in and help me position the immobilization device next to my patient. Okay. And I'm going to go ahead and ask my EMT assistant holding the head to count to 3 as we log roll our patient onto his side.
1, 2, 3.
Okay, and now we're going to reach in and position the immobilization device appropriately. Okay, and we're going to move him back onto the device on your count.
1, 2, 3.
Okay, and one additional time just to straighten him up on the board.
1, 2, 3.
Okay, great. All right, and now I'm going to apply padding to the void between his torso and the device, the lumbosacral area primarily. And now I'm going to secure the patient's torso to the device. I'm going to pad the area between my patient's head and the device. Just lift slightly. Thank you. And back. stabilize my patient's head to the device. Now I will secure my patient's legs to the device. Excuse me. And my patient's arms are already secured to the device. I'll make sure that he is not overly secured and can breathe appropriately. Now I'll reassess distal motor sensory function in all 4 of his extremities. Distal pulse is present. Sir, can you feel me touching you?
Yes.
Can you wiggle your fingers for me? Capillary refill is present and brisk. Distal pulse is present. Sir, can you feel me touching you?
Yes.
Can you wiggle your fingers for me? Capillary refill is brisk. Distal pulse is present. Sir, can you feel me touching you?
Yes.
Can you wiggle your toes for me? Thank you. Distal pulse is present. Sir, can you feel me touching you?
Yes.
Can you wiggle your toes for me? Thank you. I'm now done with my station.
Hi, I hope you enjoyed the spinal supine station. Just remember, in this scenario, as in all the others, there are critical criteria that if you do hit, you're going to fail the station immediately. So, just as a wrap up, if you don't immediately direct or take manual stabilization of the head, you're going to fail the station. Also, if you didn't properly apply the appropriately sized cervical collar before ordering the release of manual stabilization, that's an immediate failure. If you've released or ordered the release of manual stabilization before it was maintained mechanically, you'll fail the station. Remember that you're in charge of the station and you have assistant EMTs to hold manual stabilization, so they're listening to your every command, as is the evaluator. If you manipulated or moved the patient excessively, causing potential for spinal compromise, or if the head was immobilized to the device before the device sufficiently secured to the torso, that's an immediate failure. Remember that your evaluator is going to check the patient position and the strap location and tightness after you leave the station. So if your patient moves excessively up, down, left, or right on the device, you're going to fail the station. If your head immobilization allows for excessive movement, that's automatically failure. And upon completion of the immobilization, the head needs to be in a neutral, inline position. Remember to reassess motor, sensory, and circulatory functions in each extremity after immobilizing the patient to the device. That's a big area where people fail. And also the failure to manage the patient as a competent EMT, also exuding that confidence as we've talked about in the past. And you need to exhibit an acceptable affect, not an unacceptable. You need to make sure you have your values in line and you're professional when you present yourself as the leader of this scene. And if you use or order a dangerous or inappropriate intervention, you're going to immediately fail the scenario. So please take heed and review your critical criteria before the station as well as after the station.